Imagine this. You wake up feeling perfectly normal, you have breakfast, you drink your morning coffee, you head to the bathroom expecting everything to happen the way it always has. You sit down, you can feel the stool there, it's close, you know it's close, you push gently, nothing. You wait another minute, still nothing. You stand up thinking maybe your body just isn't ready yet. An hour later, you try again. The same pressure, the same fullness, the same frustrating sensation that something is stuck and refuses to move. By lunchtime, you're irritated. By evening, you're uncomfortable. And by the next morning, a thought begins creeping into your mind. What if something is actually wrong? If that sounds familiar, I need you to stay with me because what I'm about to explain may completely change how you think about this problem. You see, most people believe stool stuck in the rectum is the problem. In many cases, it isn't. It's the final symptom of a process that may have been developing quietly inside your body for days. And what concerns me most is that millions of adults over 60 are experiencing this exact problem without understanding what their body is trying to tell them. Even more surprising, one of the most common causes has absolutely nothing to do with the rectum itself. We'll get to that shortly. My name is Dr. Michael Ellis. I work in preventive health and healthy aging, and today we're going to discuss one of the most overlooked digestive problems affecting older adults. Why does stool become difficult to pass? Why does it feel like it's stuck? Why does this happen more often after 60? What warning signs should never be ignored? And what practical steps can help restore normal bowel function? Because here's the truth. Most people spend years treating symptoms while completely missing the cause. And when that happens, the problem keeps returning, again and again. Before we go any further, let me ask you a simple question. How long have you been dealing with this issue? A few days? A few weeks? Several months? Leave your answer in the comments below. I read every comment, and the timeline often tells us much more than people realize. Now let's start with something most people have never been told. The feeling of stool being stuck usually doesn't begin when you're sitting on the toilet. It often begins several days earlier. Think about your digestive system as a long conveyor belt operating silently in the background every hour of every day. Food moves in, nutrients are absorbed, waste moves forward, and eventually your body eliminates what it no longer needs. Most of the time, this process happens without any effort whatsoever. But when movement through the digestive tract begins slowing down, even slightly, something important happens. Waste remains inside the colon longer than it should. The longer it stays there, the more water is removed. Hour after hour, day after day, soft stool becomes firmer. Firm stool becomes harder. Hard stool becomes difficult to pass. Eventually it reaches the rectum, creating that familiar sensation. It's right there, but it won't come out. What many people don't realize is that by the time they notice the symptom, the process has often been developing for several days, sometimes longer. And that brings us to the first major cause. In fact, it's one of the most common causes I encounter in adults over 60. Dehydration. Now, before you dismiss that idea, hear me out, because nearly every patient I've spoken with says the same thing. Doctor, I drink water, and many of them genuinely believe hydration couldn't possibly be the issue. Then we look closer. Let me tell you about a gentleman I spoke with recently, 72 years old, otherwise healthy. He was convinced something serious was wrong with his digestive system. He described pressure, fullness, difficulty passing stool, and that constant sensation that something was stuck. When we reviewed his daily routine, a pattern became obvious. He drank coffee in the morning, tea during the afternoon, maybe a glass or two of water with dinner. That was about it. He wasn't severely dehydrated, he wasn't dizzy, he wasn't collapsing from lack of fluids, but he was dehydrated enough to affect his digestive system, and that's all it takes. Research has consistently shown that our sense of thirst becomes less reliable as we age. A younger adult often feels thirsty before dehydration becomes significant. Older adults frequently do not, which means you can be mildly dehydrated without realizing it. And here's why that matters. Your colon's job is to reclaim water. If your body senses that water is in short supply, the colon becomes even more aggressive about conserving it. The result? Drier stool, harder stool, slower movement, more straining, and eventually stool that feels trapped. I often explain it this way. Imagine leaving a wet sponge outside in the sun. After 1 hour, it changes slightly. After an entire day, it becomes stiff and dry. Your stool behaves in a surprisingly similar way when it remains in the colon too long. What makes dehydration particularly deceptive is that the symptoms often appear long after the problem began. Most people focus on what's happening in the bathroom today. They never think about what happened 3 days ago, and that's why they miss one of the most important clues. Type the word water in the comments if you think you could probably drink more fluids throughout the day. You're definitely not alone, but here's where things become even more interesting, because dehydration rarely works by itself. In fact, it often teams up with a second cause, and when these two factors combine, the problem becomes dramatically worse. Let's talk about that. Because number 2, low fiber intake. Now, fiber is one of the most misunderstood nutrients in the modern diet. People hear about fiber constantly. Doctors mention it. Nutrition labels mention it. Television commercials mention it. Yet very few people understand what fiber actually does inside the body. Fiber helps stool hold water. It adds bulk. It stimulates movement through the digestive tract. Without enough fiber, stool often becomes smaller, drier, and slower moving. The challenge is that many adults gradually reduce their fiber intake without ever noticing. Fresh fruit becomes less common. Vegetables appear less frequently. Whole grains are replaced by processed foods. The changes happen slowly. Then one day, bowel habits begin changing too. And here's the important part. Low fiber and dehydration work together. One removes moisture, the other reduces structure. Together they create the perfect conditions for stool to become hard, compacted, and difficult to pass. I remember speaking with a woman in her late 60s who was convinced she had developed a serious bowel disorder. She described exactly the same symptoms we've been discussing: pressure, incomplete emptying, the feeling that stool was constantly getting stuck. When we reviewed her eating habits, one thing stood out immediately. She was consuming almost no fiber, very little fruit, very few vegetables, almost no whole grains. Over the following weeks, as her fiber intake gradually improved, her bowel movements became noticeably easier. Now, fiber doesn't solve every case, but it's often one of the missing pieces people overlook. And what I'm about to discuss next may surprise even more people, because the third cause is sitting in medicine cabinets across the country right now, and millions of people don't realize it may be contributing to their symptoms. Because number 3, medications. This is one of the most frequently missed causes of constipation and difficult bowel movements in adults over 60. And the reason it gets missed is surprisingly simple. The connection is often delayed. Here's what typically happens. Someone starts a new medication. Everything seems fine. Days pass, then weeks, maybe even months. At first, bowel movements become slightly less frequent. Nothing dramatic. Then they begin straining a little more. The stool feels harder, the sensation of incomplete emptying starts appearing, and eventually they find themselves sitting on the toilet wondering why stool constantly feels stuck. The problem is that by this point, the medication has become part of daily life. Nobody thinks to question it, but many commonly prescribed medications are known to affect digestive movement. Pain medications are among the biggest offenders. Iron supplements frequently contribute. Calcium supplements can play a role. Certain blood pressure medications, allergy medications, and antidepressants may also slow intestinal movement in some individuals. A large percentage of older adults take multiple medications every day, which means multiple factors may be working together. Now, let me be absolutely clear. This does not mean you should stop taking prescribed medications. Please don't do that. Many of these medications provide important health benefits. What it does mean is that if your bowel habits changed after starting a medication, that's a conversation worth having with your doctor or pharmacist. Sometimes a small adjustment can make a significant difference. Sometimes an alternative option exists, and sometimes simply identifying the connection helps explain what's happening. Before we continue, tell me in the comments, do you currently take more than 3 medications every day? Just write yes or no. Now let's move to a cause that affects every single person watching this video. Cause number 4, age-related slowing of intestinal movement. Doctors refer to this as motility. Think of motility as the engine that powers your digestive system. Every day, your intestines perform thousands of coordinated muscular contractions that move waste forward. When you're younger, those contractions tend to be strong and efficient. After age 60, things begin changing, not suddenly, not overnight, but gradually. The digestive engine starts slowing down. Waste remains inside the colon longer. More water is absorbed. The stool becomes firmer. Passing bowel movements becomes more difficult. And because the change happens slowly, most people don't notice it until symptoms become obvious. I often hear people say, "Doctor, this wasn't happening 10 years ago." And they're absolutely right, because 10 years ago, their digestive system was functioning differently. One of the most frustrating aspects of age-related motility changes is that they often create a cycle. The slower stool moves, the harder it becomes. The harder it becomes, the slower it moves. And eventually, the sensation of stool being stuck becomes more frequent. But here's the encouraging news. Although aging affects motility, inactivity often makes it much worse. And this is where many people unknowingly make the problem worse. Research consistently shows that physical movement stimulates digestive movement. In simple terms, when your body moves, your intestines move. When your body spends long periods sitting, digestive activity often slows. That's why one of the most powerful tools we'll discuss later costs absolutely nothing: a simple daily walk. But before we get to the action plan, there's another cause we need to discuss, and this one surprises almost everyone. Because number 5, ignoring the urge to go. At first, it sounds harmless. Life gets busy. You're shopping, driving, visiting family, watching television. You feel the urge to have a bowel movement and tell yourself you'll go later. And occasionally, that's perfectly fine. The problem develops when later becomes a habit. Because every time your body sends a signal that it's ready to eliminate waste, it's presenting an opportunity. When that opportunity is repeatedly ignored, stool remains inside the rectum longer than intended. And the longer it remains there, the more moisture gets absorbed. The stool becomes larger, drier, harder, more difficult to pass. Eventually, something else can happen. The body's signaling system becomes less predictable. People begin saying things like, "I don't feel the urge the way I used to." That's because the body adapts. And unfortunately, that adaptation often makes future constipation more likely. If you've ever delayed going to the bathroom because you were busy, type the word "later" in the comments. Most people have done it. The difference is that occasional delays rarely cause problems. Repeated delays often do. Now I need your full attention, because the next section could help you recognize when this stops being an uncomfortable nuisance and starts becoming something that requires medical attention. Most cases of stool stuck in the rectum are manageable. They're frustrating, they're uncomfortable, but they're not necessarily dangerous. However, there are situations where your body may be sending a very different message, and recognizing those warning signs early can make an enormous difference. The first warning sign is severe abdominal pain, not mild discomfort, not bloating, not pressure. I'm talking about pain that continues worsening, pain that makes it difficult to stand upright, pain that interferes with normal activities, pain that feels dramatically different from ordinary constipation. The second warning sign is vomiting. This surprises many people because they don't immediately associate vomiting with bowel problems. But when constipation becomes severe and vomiting develops, it's a signal that professional evaluation may be needed. The third warning sign is significant abdominal swelling. Many people describe it as feeling unusually tight, distended, almost as though their stomach has suddenly expanded. You should also pay close attention to blood in the stool. While hemorrhoids can sometimes cause minor bleeding, persistent or unexplained bleeding should never be ignored. And now I want to discuss the warning sign that often surprises families the most: sudden confusion, particularly in older adults. I have seen situations where caregivers notice changes before the person experiencing the bowel problem did. An aging parent becomes unusually confused. A spouse seems more agitated than normal. A loved one suddenly appears mentally different. While many conditions can contribute to confusion, significant bowel problems can sometimes be part of the picture. That's why caregivers should always pay attention to digestive symptoms when unexplained behavior changes appear. And here's something important to remember. Most digestive problems are easier to address when recognized early. Waiting rarely improves the situation. Now, if you're still watching, I want you to stay with me because we're about to move into the most practical part of today's discussion: the action plan. And one of the biggest mistakes people make when stool feels stuck is exactly the opposite of what they should be doing. In fact, that mistake may actually be making the situation worse. Let's talk about that next. Now let's talk about what you can actually do. Because if you're watching this video right now, you're probably not looking for a biology lesson. You're looking for relief. And while every situation is different, there are several practical steps that can help support normal bowel function and reduce the likelihood that this problem continues. Step number 1, stop excessive straining. I know this sounds simple, but it may be the most important thing I tell you today. When stool feels stuck, the natural reaction is to push harder, then harder again. Unfortunately, that's often exactly the wrong approach. Excessive straining increases pressure inside the abdomen. It can aggravate hemorrhoids, it can irritate sensitive tissue, and in some cases, it can even cause dizziness or lightheadedness. I once spoke with a gentleman who spent nearly 40 minutes straining because he was convinced that if he just pushed a little harder, the problem would finally resolve. Instead, he ended up exhausted, uncomfortable, and no closer to relief. The body responds much better to relaxation than force, slow breathing, patience, allowing the muscles of the pelvic floor to relax naturally. Sometimes that simple shift makes more difference than people expect. Step number 2, improve hydration consistently. Notice I didn't say drink a huge amount of water all at once. That's a common mistake. The goal isn't flooding the body with fluids. The goal is consistency. Research has repeatedly shown that adequate hydration helps support stool softness and normal digestive movement. One habit I frequently recommend is drinking a full glass of water shortly after waking up. Before coffee, before breakfast, before anything else. After several hours of sleep, your body naturally starts the day slightly dehydrated. That morning glass of water helps replenish fluids and often encourages digestive activity as well. Many people underestimate how powerful simple consistency can be. Step number 3, move your body every day. This may be one of the most overlooked digestive tools available, and it costs absolutely nothing. Physical activity stimulates intestinal movement. Even modest movement helps. You don't need intense exercise. You don't need a gym membership. You don't need to run marathons. A simple 15 to 20-minute walk after meals can make a meaningful difference. I remember speaking with a retired teacher in his 70s who had struggled with constipation for years. He expected a complicated solution. Instead, one of the most helpful changes he made was taking a short walk after dinner every evening. Not fast, not strenuous, just consistent. Within weeks, he noticed a difference. Sometimes the most effective solutions are also the simplest. Step number 4, pay attention to toilet posture. Most people never think about how they sit on the toilet, but posture changes mechanics. The human body evolved in a squatting position. Modern toilets place us in a seated position that doesn't always align perfectly with the anatomy of the rectum. A small footstool placed beneath the feet can elevate the knees slightly above the hips. That simple adjustment often changes the angle of the rectum and allows bowel movements to occur more naturally. Many patients tell me they were skeptical. Then they tried it, and afterward they wondered why nobody had mentioned it sooner. Step number 5, create a consistent routine. Your digestive system thrives on predictability. When meals occur at similar times, bowel movements often become more predictable as well. One strategy I frequently recommend is setting aside a few quiet minutes every morning, not forcing anything, not straining, simply creating an opportunity for the body to establish a pattern. Over time, many people notice that their digestive system begins responding more consistently, and consistency is often the key. Before we continue, type the number 3 in the comments if you've learned something useful today. I genuinely enjoy reading your responses and hearing about your experiences. Now I want to discuss a mistake I see surprisingly often. Panic. A person becomes constipated. They become worried. Then they start trying everything at once. Multiple supplements, different laxatives, internet remedies, advice from friends, advice from strangers online. And before long, they have no idea what's helping and what's not. A structured approach tends to work much better. Address hydration, address fiber intake, address physical activity, review medications when appropriate, and seek medical guidance if symptoms persist or worsen. That approach is far more effective than jumping between 10 different solutions every few days. Now let's talk about prevention. Because preventing stool from becoming stuck is always easier than dealing with the problem after it develops. The foundation of prevention is surprisingly simple. Drink enough fluids, eat adequate fiber, stay physically active, respond promptly when your body signals that it's time for a bowel movement, review medications whenever bowel habits change, and maintain consistency whenever possible. None of these habits are exciting, none of them are dramatic. But together they create an environment where healthy bowel function becomes much more likely. I often compare digestive health to maintaining a garden. You don't wait until the plants are dying before providing water and care. You create the right conditions consistently. The same principle applies here. Small daily actions often produce the biggest long-term results. Now I want to take a moment to speak directly to caregivers, because some of you aren't watching this video for yourselves. You're watching for a spouse, a parent, a sibling, or another loved one. And if that's the case, I want you to remember something important. Bowel problems are incredibly common in older adults, but many seniors feel embarrassed discussing them. Pay attention to subtle changes. Notice prolonged constipation, notice reduced appetite, notice discomfort while sitting, notice changes in mood, notice unusual confusion or agitation. Sometimes caregivers recognize a developing problem before the individual experiencing it does, and your attention may help prevent a much larger issue later. As we begin wrapping up, I want to return to the most important message from today's discussion. Feeling stool stuck in the rectum is not simply something you should accept as a normal part of aging. It is often a signal. Your body is trying to tell you something. Perhaps dehydration is contributing. Perhaps fiber intake has gradually declined. Perhaps a medication is affecting digestive movement. Perhaps age-related motility changes are playing a role. Or perhaps several of these factors are working together at the same time. The goal isn't fear. The goal is understanding. Because when you understand what your body is trying to tell you, you can respond appropriately. And when you respond early, outcomes are often much better. Let's quickly review the 5 major causes we discussed today. Number 1, dehydration. Number 2, low fiber intake. Number 3, medication side effects. Number 4, age-related slowing of intestinal movement. And number 5, repeatedly ignoring the urge to have a bowel movement. For many people, more than one of these factors is present at the same time. That's why lasting improvement often requires looking at the bigger picture rather than searching for a single cause. And the encouraging news is that many of these factors can be improved. Sometimes meaningful progress begins with surprisingly simple changes. More hydration, more movement, more consistency, more awareness of how your body is functioning. Before you leave, I'd like you to answer one final question in the comments. Which of the 5 causes surprised you the most? I read the comments personally, and your answer may help someone else recognize a pattern in their own health. If you found today's discussion helpful, please consider sharing this video with a friend or family member. Digestive issues affect millions of people, yet many suffer quietly because they're uncomfortable talking about them. The more we understand these problems, the better equipped we become to address them. And if you haven't already subscribed, make sure you do. Because in an upcoming video, I'm going to discuss several digestive warning signs that many adults over 60 mistakenly dismiss as normal aging, even though they may be pointing towards something much more important. That's a conversation you won't want to miss. Until next time, take care of yourself. Stay hydrated, stay active, listen to your body, and remember, small daily habits often create the biggest improvements in long-term health. I'm Dr. Michael Ellis, and I'll see you in the next video.